Delekyan. I am honored to be the chair of NGO CSW, to be part of an amazing executive committee who I see some here on the screen, and you're going to meet two of them today actually who helped organize this amazing panel and discussion that I'm so excited and looking forward to hearing. I also want to give a quick shout out to our office manager and extraordinaire Devon, who's hosting and keeping everyone quiet while we have this meeting. She's been a rock, amazing person to really just plow through with everything that's coming up and we're throwing at her. So we're grateful for her. And I am all of our members. It's, you know, I see so many familiar faces. Hi, Madeline. Hi, Susan. Hi, everyone. So I'm going to give you a quick, brief update. This is what, when we used to meet in person, we would have a business meeting time. And I'll give you as much as I know and I can this time, because this is actually our final meeting until September. We don't usually meet in the summer, so we're not going to, even though we could virtually, if something really important comes up, obviously we'll send a notification and we'll gather us all together. But it's not going to be a lazy summer. We have so many activities that we have taken on, and you will all obviously receive our emails updating you on what's going on. A couple of tell you that one of the activities, one of the projects that's keeping us very busy is, of course, Generation Equality Forum. NGO CSW New York is still the Civil Society Advisory Group convener. We are meeting regularly. We are rethinking our approach with the delay of the forums. I'm very honored and impressed with the team that I'm working with. My vice chair, Ivy, is actually my backup, and she will hopefully start being even more active going forward, but she's amazing. She steps up on everything, so I want to give a shout out to Ivy as well. Thank you. So yeah, we'll be continuing to meet with the Generation Equality Forum advisory group and letting you know with our monthly newsletters, which comes out on the last Friday of the month. That newsletter is specifically for Generation Equality Forum updates, and you will still be receiving that over the summer. And you will also keep receiving our NGO CSW newsletters, which comes out, and it's been coming out, I don't know how many we're up to now, but it's been going on for at least 2 years now. That still comes out the first Friday of the month, and that will give you information of what's going on. So a few other partnerships that I want to highlight. First, let me just start by saying FWMAP, Feminist Women's Movement Action Plan, which is came out of the Generation Equality Forum activities, is led by our past chair, Sun Young Yoon, Melissa Upreti, Krishanti, and is going to be moving forward with amazing projects that they've taken on. There's the university teach-ins. You will see that in our newsletters as well, and also on our website. You can go on our website and check it out and join if you wish. Erica Higbee, a past executive committee member, actually is leading the university project, and it's so good to have her back leading that one. We're also partnering with them with the online UN book project, which hopefully you have seen. Again, you will see that in the newsletter and hopefully on our website too. We are honoring UN 75, and just recently we also approved and are partnering to highlight to have a separate chapter for UN Women at 10. As you know, this year UN Women becomes 10 years old, and we want to celebrate them and honor them with stories. So if you have any stories that you can share, and I see Mary Luke here, so she's helping us lead that. We will send you, the information will be in the newsletter, and we will also send you, I think the chapter opens on July 3rd or 6th, 2nd. Okay, July 2nd. Thank you, Mary Luke. And yeah, you will have the link in our July 3rd newsletter. So I'm excited about that as well. Another event that we're helping co-sponsor is a high-level political forum side event. And that information also you will have in the newsletter to sign up. It's, I believe, July 8th. We're confirming our speakers. The time is still at 1:15. So you please look out for that event as well. Another event I'm very excited about is the Youth Speak Out. We just sent the save the date yesterday. Hopefully you received it. I'm just so excited and proud of our youth co-chairs, Safira and Saida, along with Devin, who helps organize these events. And it's a series, so the next one will be really, really important. So please stay alert on that one and share it with your youth members. That's just about my important announcements. Also very important to say CSW 65 is still a question mark, right? We know it's going to happen. We know we're going to be part of it. We know we're going to help organize it. We're just not sure what it looks like yet. We've already started conversations amongst the executive committee members and also our partners to see the options and possibilities of perhaps doing it all online, partial online and partial in New York City. Obviously, this all depends on what UN decides, because we are here to support civil society's voices while the UN meets during the Commission on the Status of Women. That is our mandate, and we're going to keep to it, and we'll do it. So I didn't want to say a lot more because we really don't know more. But just so that you know, we're on top of it, we're researching, we're going, and if any of you join any kind of large online meetings like that, and you find successful ways of convening virtually, please do share with us. Send us information at info@ngocsw.org. We're always open for suggestions and ideas on how others are meeting and what success they're finding. I mean, I'm loving Zoom so far, although we are all done with so many meetings and looking at screens, but it works. And I think it's important to show the world that we're not going to slow down our activism, no matter what happens. So at this point, I think we've had almost everybody join us. I really do want to introduce, I'm so excited that she agreed, one of our amazing executive committee members who helped organize this meeting as well. And she's an activist and involved in so many things. I wanted her to actually take a few minutes for all of us to honor Juneteenth, just so that we're centered, we're aware of what's going on around the world. So give us a few minutes or more of your time. I want to invite Yvonne to help us kind of center ourselves. The floor is yours, Yvonne, to do whatever you want. I actually was just going to do a moment of silence, and hopefully we will also have that. But I really would love Yvonne to take over and give us her wisdom and comfort in these trying times. Thank you so much for agreeing to do this, Yvonne. The floor is yours.
Thank you, Huri. Good afternoon, all. We are living in unprecedented times in this time of COVID-19 and what's happening in the United States. And tomorrow is Juneteenth, which is the day when we remembered that it took 2.5 years before Black folks knew that they had been emancipated from slavery. And so this is a big moment in our history, and it's commemorated every day. And so there's so much to be inspired by, and nowadays, even with all that's going on, but we press forward. So the struggle continues in the United States for freedom for Black people, but we continue to fight. And I just want to read from the Black National Anthem by James Weldon Johnson, and then we can have a moment of silence. God of our weary years, God of our silent tears, thou who has brought us thus far on the way, thou who has by thy might led us into the fight, keep us forever in the path, we pray. Lest our feet stray from the places, our God, where we met thee, lest our hearts drunk with the wine of the world we forget thee, shadowed beneath thy hand, may we forever stand, true to our God, true to our native land. And so, as I said, the struggle continues, and all of us continue in the struggle, and we believe that this country can be what it started out to be, a land of the free for everyone, and we're fighting for that. And I ask you to join me in that struggle. And now let us have a moment of silence for all those who have died in the struggle, and especially those who have died in the last few weeks in this country. Thank you. And as we cannot separate the pandemic from what's happening, everything is tied together. There is the intersectionality in terms of fighting for freedom, fighting for justice. And as we know, this pandemic has had a big mark on women. Women have bear the brunt of it, especially in terms of caring for those who are sick, and so much unpaid work that women have to go through. And so today we thought that we would bring this all together and talk about the health and the economic aspects of this, because as we can see, there is a tremendous economic toll that's taken place because of the pandemic. So we brought these wonderful speakers together today, and now I'm going to turn it over to Rosa so she can tell you a lot more about our program today. Rosa, the floor is yours.
Thank you, Yvonne, and thank you, Huri, and a warm welcome to everyone here today. Good afternoon, good morning, good evening, perhaps you're tuning in your night time. We welcome you here today to our program, A Multilateral Approach to the Gender Impacts of COVID-19, looking at the intersection of health and finance. And Yvonne, thank you, my partner, in helping to plan this, together with the staff of the CSW NGO, with Huri, and the executive committee members. We are living in an unprecedented time, as Yvonne has laid out. We're looking at the issues of impending crises, not only a health crisis, impending finance crisis, an economic crisis, but also looking at an impending multilateral crisis. In that sense, we look to our main focus of advocacy for many of us here, which is the UN, and we look to ensuring that there is cooperation and collaboration at the UN. And that is something that we all have to work at. So for today, we're going to be also looking at all of these intersections and why this issue of multilateralism is so important. We have some stellar speakers today. We are so happy for this panel that we have today. We're going to take a sort of a global approach and get information and overview from a global perspective, and also look at issues very closely, of course, relating to women and girls, their communities, their families, and then move to a regional perspective, looking at the African continent, but not only within itself, but within the global context. And then we're going to go to look at some more local issues in focusing on New York, where we are based as a CSW NGO. So without further delay, I want to introduce my panel, my panelists individually before they speak. So I'm going to call for, if those who have video can maybe turn off your video so we can highlight our speakers. And if you want to put it on speaker view, you will be viewing the person who is speaking. And this way we highlight our speakers. So without further delay, I'm excited to introduce Dr. Nata Menambe. She is the Executive Director of the World Health Organization Office at the United Nations in New York. She's been in this post since May 2015, where she promotes the WHO's engagement with the UN system and with a broad range of stakeholders to anchor health in the 2030 Agenda for Sustainable Development. Prior to her role in New York, Dr. Menambe was head of mission and WHO representative to India, leading a large team with thousands of dedicated professionals in over 250 offices across the country, and where she saw one of the biggest achievements in public health, a polio-free India. She also served as Deputy Regional Director at the WHO Regional Office for Europe from 2006 to 2010, where she successfully led the region's work on strengthening health systems. During this period, she was also in charge of the WHO's operations in 35 European countries, which included emergency response and a post-conflict recovery and rehabilitation. So with all that breadth of experience, I know we're very thrilled to have her here. Dr. Menambe, can you please unmute yourself?
Yes, I can.
And we welcome you. Thank you. You have the floor.
Thank you, ladies and gentlemen, colleagues and friends. It's a great honor to speak with you today and to revisit a lot of important issues that are in our heads as we respond to the current pandemic, but also as we think of the future that we want to build. Clearly, pandemics and outbreaks have differential impact on women and men, and from risk of exposure and biological susceptibility to infection to social and economic implication, the experience of individuals are likely to vary as we move forward. The global and country strategic plans for COVID-19, which many have prepared already for the preparedness and response, indeed should be grounded much stronger on gender analysis and ensure meaningful participation of affected groups, including women and children, in decision-making, but also in the implementation of those plans. And it's really essential that all global actors guide investments in quality and gender-sensitive research on the adverse health, social, and economic impacts of COVID-19, and to prominently incorporate a gender focus in the response. I'd like to highlight several important points that we should be addressing when considering multi-sectoral approach to the gender impacts on COVID-19, because none of these problems can be solved by one single area or sector. First and very important point is limited availability of sex and age disaggregated data, which indeed hampers the analysis of the gender implications of COVID-19 and development of appropriate responses. As of early May, only 40% of total confirmed cases have been reported to WHO with age and sex disaggregation. Now, what it tells us that we don't really have a very clear picture, and only preliminary analysis can be done, which shows that there is relatively even distribution of infection between women and men, 47 to 51% it is, but there are of course variations in different age groups. And data on the individuals tested, severity of disease, hospitalization rates, discharge, health worker status that are disaggregated by sex and age at minimum, as well as other stratifiers such as socioeconomic status, ethnicity, gender identity, refugee status, and others where feasible, could indeed help us to better address COVID-19 related health inequities. I cannot avoid or forget to mention issue of violence against women and children, which is terribly increasing during this lockdown. Before the pandemic, globally 1 in 3 women worldwide had experienced physical or sexual violence by an intimate partner, or sexual violence by any perpetrator in their lifetime. And most of these are intimate partner violence cases, of course. But as women care burden during COVID has increased and whole livelihood has been affected, access to basic necessities has reduced, and social and protective networks have become disrupted. There is an increased stress on all households, and that leads to potential increase of risk for violence. The health sector has inevitably critical role in mitigating the impact of violence on women and children as part of COVID response, including access to essential services for survivors of violence. And the member states of United Nations and the partners with whom we work are all very strongly encouraged by WHO to include responses to violence against women, and in particular intimate partner violence, as an essential service of COVID-19 response. And resources need to be identified and invested to make services accessible in the context of lockdown, which everybody is experiencing as a challenge now. I would like to mention access to sexual and reproductive health and rights of women and girls, which are being affected and reduced during the pandemic. Clearly, health system capacities are overstretched in every country. Governments and facilities are making inevitable choices for prioritizing of provision of some health services and scaling back others. And there is a risk that sexual and reproductive health services will be scaled down, which will inevitably result in maternal mortality increase, unintended pregnancies, other adverse social and reproductive health outcomes among women and girls. We need to remember of that. There is important factor of stigma and discrimination, which is now occurring and can indeed hamper any effective response in any area, so in pandemic in particular. We have seen here an anxiety about COVID-19, which has led to discrimination in some countries. There have been reports about discrimination against infected persons or against healthcare professionals who are serving people, or some ethnic communities, or some people who have even traveled to the places where pandemic has been taking many lives. So this stigma and discrimination absolutely has a very negative impact on individual, on physical, mental, or social well-being, but it can turn also into the physical violence, social rejection, and limitation or access to health services, education, housing, employment, you name it. So these are all very significant implications. And finally, I really want to mention health and social workers who face increased risk and vulnerability in the current situation. As women constitute 70% of global health workforce and are highly represented at all front lines in every country, they are inevitably under high risk of frequent exposure to COVID-19 infected patients with high viral loads. And what we have seen in Spain and Italy, it can come up to 72% and 66% in Italy, for example, where healthcare workers got infected with the COVID because they are with patients. So the such data on infected health and social workers is not collected sufficiently accurately, and we need to put good measures in place to safeguard health workers so they can perform those essential functions and provide services they need, be it health or social services. So there are a lot of those health inequalities which emerge in COVID-19, in addition to already existing ones. And they involve more inequality with respect to health determinant, access to health resources needed to improve and maintain health or health outcomes. But they also entail a failure to avoid and overcome inequalities that infringe on more basic issues such as human rights and human rights norms. And we really need to be aware of that. In the COVID-19 crisis, the poor and disadvantaged subpopulations will likely bear the brunt of deaths from three causes: the COVID itself, the inability of health system to provide ongoing routine essential health services, and increased levels of poverty and deprivation that will negatively impact health service usage and other key determinants of health. So we need to focus on health equity lens, and in the current context, we have to minimize morbidity and mortality amongst the most disadvantaged populations. We recommend within WHO, of course, we stand for the universal health coverage concept, which has been so strongly supported as a concept, and commitments have been made last year during the General Assembly at the UN when the resolution of the General Assembly has got adopted. This is an equity-oriented approach to health, which we define as when people can receive all the services they need of sufficient quality to be effective and to meet all their needs in terms of health services without undergoing through financial hardship and paying for services. This brings me to the interface between health and finance. The unfortunate reality today is that even prior to COVID-19, the world was not on a right pace progressing towards universal health coverage goal that should be achieved by 2030. Based on current trends, it was projected that 2030 will only get us somewhere where half of the population, say between 40 to 60% of the global population, would be covered by essential health services. And while there has been some gains in progress in many countries, the incidence of catastrophic health expenditure increased continuously between 2000 and 2015. So the trend was negative, and overall financial protection is deteriorating and not improving. Of course, this is only going to get worse in the epidemic or in its aftermath. And that happens despite of many countries having increased their public investment in health, and sometimes even more investments were made in the growth of GDP. So health budgets have grown faster and better. Still, this current pandemic will draw us back in this progress. Governments absolutely need to rapidly scale up their investment in core functions and ensure sufficient funding for common goods for health. That is a very, very important critical point, because those core public health functions require collective actions and can only be funded by the governments. Otherwise, we risk large market failures. So these services, these functions simply will not be provided. And that includes issues such as policymaking based on evidence, risk communication, empowering individuals and families to better manage their own health, information systems, data analysis, surveillance, building laboratory capacity for testing, regulating for quality of products and healthy behavior, and subsidies to public health institutes and programs. All these cannot be provided by market forces, and we have to really make sure that governments are well tuned to step in and cover for those services. It is critical.
Excuse me, Madam Anand, just
Yes.
1 minute, please. Thank you.
Yes. I'm just coming to the end of my intervention, and I think that we need to also focus on the investments in healthcare for a longer term results, and we need to see how the socioeconomic packages which are going to be implemented by like stimulus plans for health equity supporting interventions can be reinforced and can be made stronger. And there is a common understanding that investment in health and strengthening of health system is going to be the only way to build back better for any future pandemics. Thank you.
Thank you so much. We're so appreciative of you giving that overview, not only of health, but bringing in the finance aspects. That's very, very important. And also highlighting the health inequalities and what is needed by making those recommendations about needing gender disaggregated data and to address violence against women and children. If you can reply to one quick question that came up, there was a focus on addressing concerns of youth related to sexual and reproductive health. One participant asked if you can just quickly speak on how concerns of older women are being addressed within this context of COVID.
I think there are at the moment a lot of various kind of policy briefs that WHO has been developing to address multiple aspects of this pandemic, and impact on elderly in particular is a very specific topic, which is showing us that impact has been devastating for many elderly. There are ethical questions that are being asked, how the elderly people's needs are addressed. There are mental health issues and so on. In case of women, women very often live longer lives, as we know in many countries. However, it is also true that this is not the equal quality of life that they live. Their income is often less than male income and so on. So women, especially elderly women, are indeed affected a little bit stronger and more profoundly than men, unfortunately. So it is really the government issue which we are trying to bring up through data collection and analysis and policy recommendations, how the protective measures can be put in place in national country strategic plans and regional plans. This is an issue. It has financial implications. It has ethical implications, and it is clearly surfacing as we are moving forward.
Thank you so much, Madam Minadbe. That was excellent to hear. We're going to move on to our next speaker, Madam Nafissatou Jocelyn Diop. If you can please identify yourself, put on your video. Oh, okay, great. We see you. Welcome, Madam. Thank you. Thank you so much for joining us. Ms. Diop is the Chief of the Gender and Human Rights Branch at the United Nations Population Fund, also known as UNFPA, where she leads programs to change entrenched social norms and harmful practices. In her role, she promotes gender equality and the empowerment of women and adolescent girls within UNFPA's strategic plan to achieve 3 transformative goals: ending preventative maternal deaths, addressing unmet need for family planning, ending gender-based violence and harmful practices. So with the wealth of information, over 20 years of experience advocating for sexual and reproductive health and rights and gender equality, we welcome you. Madame, you have the floor.
Thank you so much, and it's a pleasure to be here today, and thank you for inviting UNFPA. I'm representing Dr. Natalia Kanem, our Executive Director, who is sending her greetings, and as you imagine, she has a heavy agenda these days, and unfortunately she couldn't be here with you today, but she just wants to she told me to tell you that, of course, she's coming from civil society organization, and most of her career was there, and so the work that civil society organizations are doing and women's group and all this feminist approach and movement is so close to her heart. So she's sending her greetings. And I want to repeat what has been already said by my colleague from WHO, and maybe try to just bring some additional components. So that is a little bit challenging, because I also started by putting the whole picture of COVID-19 and what it creates as a global public health crisis for us and what that means. But I will just go through, to complement these few points on particularly linked to sexual and reproductive health and rights, which is our mandate, which include, of course, for us, as you said, the 3-0, zero preventable maternal deaths, zero medicine need for family planning, and zero gender-based violence and harmful practices like child marriage and FGM. So regarding that particular area, what we have definitively and is so clear is that this pandemic has severely disrupting, the access to sexual and reproductive health services. And of course, the pandemic, as it had been said, and we all know and read here and there, has deepening existing gender inequalities, increasing gender-based violence, and worsening discrimination and barriers for marginalized groups. And so for us, sexual and reproductive health and rights is a significant public health issue that demands urgent and sustained attention and investment. So I'm going to bring some additional data to what my colleague from WHO has said. What we have estimated as UNFPA, and it was very urgent actually to try to put some numbers behind all these, things that we were talking about, but which could have been seen as anecdotal if we do not have the data to back up, and agree with WHO that the issue of data is crucial, and we are still struggling with it. So some of the work that we have done was showing that we have 47 million women in 100 low and middle income countries that may not be able to access modern contraceptives, and 7 million unintended pregnancies that are expected to occur if lockdowns carry on for 6 months, which is actually we are approaching it in several countries now. And there are major disruption, and if the disruption to health service continue. I was in a panel, I'm moderating a panel last week that the ED is organizing, and you're all invited to the what is next for women panel and conversation. And the minister from Sierra Leone was able to tell us, very clearly the numbers of young and unintended pregnancy by young girls that occur after the Ebola crisis in her country. So we know that this is one of the consequences, of course, when there is this kind of disruption. And it creates a lot of problems. So we need to really act, and another additional projection that the UNFPA has done was to look at, the gender-based violence also, and be able to use the lowest percentage of increase of gender-based violence during crisis and conflict. And that lowest number that was reported when we started to do this analysis in February was coming from few countries, and was showing that the lowest number is 20% of increase. And in some countries, it is much more than that. So the researcher model with a 20% as a minimum of increase that is expected. And it showed that actually we can see about 31 million additional cases of gender-based violence that can occur if lockdowns continue for at least 6 months. And the number of 15 million every 3 months additional. So those are really important, numbers that's what showing, you know, the huge increase of and the reality of COVID on data, really, and try to put, you know, the fingers on what we are facing here. And of course, I'm not going to talk about the 30 million child marriage that are also can take place, and the 2 million additional female genital mutilation. So those are numbers that you know, are really striking. And the health and social system, of course, you know, across the globe are struggling to cope. We are all seeing that everywhere, developing countries, global south or global north. And the situation is, of course, as we know, particularly challenging in humanitarian, fragile, and low-income country context. So what's exactly that means for us, you know, is really working hard to make sure that the continuum of comprehensive sexual and reproductive health services, including antenatal, perinatal, postnatal care, screening, tests, etc., will continue to exist. So what that means for us is that the essential services for gender-based violence, you know, needs to be included into national response for COVID, which is not the case, because at this point, we only had essential services for GBV that was, you know, national priorities of 51 countries only. So I'm not talking about, you know, having them consider now within the COVID response that the essential services for gender-based violence is part of the national priority. So we are really working and advocating to ensure that this is happening. And one of our main issue and problem is that when we are looking at the national response and several national response, what we are seeing is that women's leadership is not there. We are not seeing on the fair front of the response and COVID response, you know, a strong representation of women leadership. And so the power is dominated by male, and the response, of course, is you know, is going to be gender blind or gender biased. So this is one of the big issues. Then I would like to maybe address a little bit the homogeneity and the intersectionality. When we are looking at the women's and talking about particularly women's and you know, and girls, we are thinking at them as an homogeneous group. But we know that women experience varying and intersecting form of discrimination, which can be aggravating, of course, the negative impact and gender-based violence, etc. So the discrimination is multidimensional and is exacerbated by other form of discrimination based on age. And I agree that the aging issue and the older women within this whole response to COVID is not sufficiently, you know, highlighted. The ethnic origin, the disability is another issue, the poverty level, the sexual orientation and gender identity, migrant status, marital and family status, etc., etc. So we are facing a huge, you know, needs for analysis of this intersection oppression, you know, that you know, women and girls can face, and we shouldn't look at them as an homogeneous collective. Group and homogeneous collective lack of access to sexual and reproductive health. Then to finish, I think that probably my time is done, almost done, but I just want to flag one additional point, which is about the funding and the money. And there is also a latest publication that were issued regarding the, you know, an analysis of the funding to really look at the combined effects of low level of funding that are requested and receive, you know, to address, you know, several gender issue under this COVID pandemic or under humanitarian issue in general. And that, you know, there is a big area of, that needs also to be addressed there. The need to, first of all, the recognition that there is very small funding, and that's, if I have notes here that about 31% of the funds, for GBV are only covered, only 1%. So it means that about 70% of requested are not met. 43% for reproductive health is what we have currently. Means that we have about 60% that is not covered. So we know that funding for local organization, local grassroots women's organization is lacking really, and we welcome, of course, some of the new initiative by Canada and all to try to compensate this situation. But we also know that there is a need to track the flow of funding, and so the big funds, that are supposed to come and support, and mitigate somewhere or help us in moving forward in our gender agenda and financing our gender agenda. So I will stop here, and I would like to thank you really for inviting me. Thank you.
Thank you so much, Madame Diop. Thank you for bringing not only this wealth of information, a lot of statistics, staggering statistics, in fact, but also highlighting how this COVID lockdown is such a major disruption. And I think it's important bringing in the financing aspect, and I think our next speaker will be able to elaborate on some of that as well. I have a really quick question from a participant, if you will. You spoke about female leadership and the lack of female leadership. And one of the questions that has come up is, knowing how patriarchy rules most African countries, would you say that women are given the same opportunity to test for COVID-19 the same way men are given?
Yes, thank you so much. I mean, I want to talk only about African countries, but I think that we are facing that challenge in quite a lot of part of the world, right? And I think that it's clear that access even to testing is discriminating against women. And if we only look at the places and the spaces where testing facilities as testing is offered, it's already a problem. And this is why I was talking about women leadership in the national COVID response, to really bring the attention on where and what can facilitate access to women, based on the fact that we know that they are the caregiver, they are the the health providers, they are the family and the children, care, and so all these elements means that even the choice on where you have those testing facilities or points, need to be look with a gender lens. And the hours of opening and the just to facilitate the process. So we so it's a reality, and so this is why we were very worried at the beginning, and hopefully I think that a lot of countries have addressed it a little bit, but we were really worried when we saw that the response was really a male-dominated and power response were visible, at least on the TV and everywhere, government and all, and the women were not there. And so that was where we started to ring the bell, and a lot of documents and guidance were issued here and there, and systematic approach to governments also to flag this issue. But there is still, I mean, a country like China, where they force nurse to cut their hair to be able to walk more easily, or to take some contraceptive to stop their period in order, not to disrupt the capacity to work. I mean, a lot of human rights violation, women's rights violation to have hair and to have their menstrual every month. So yes, it is. I think that we need to do more. We need to be very, very important.
Thank you so much. Well, if this information doesn't light a fire under us to do our advocacy work, I don't know what does. Thank you so much, Madam Diop. We're going to move on to our next speaker, Crystal Simeone. I saw you earlier, Crystal, but maybe you want to turn on your
I have turned on my microphone.
Oh, there you are. Hello, Crystal. Welcome.
Hi. Thanks.
Thank you. So let me introduce you. Crystal is a feminist Pan-African activist who currently serves as a director at NAWI AfriFem Macroeconomics Collective, a new initiative she will tell us about. She previously served as head of advocacy and lead on economic justice at Femnet, one of Africa's largest women's rights networks, with over 600 members in more than 45 countries. She led Femnet's work to ensure that women from Africa have the capacity to articulate their issues through a Pan-African feminist macroeconomic lens and are meaningfully represented in policy spaces. Prior to working at Femnet, Crystal was policy lead on international financial architecture at the Tax Justice Network Africa, where her duties included policy and advocacy at a Pan-African level with governments, donors, and organizational members and partners on tax justice issues on the continent. So she brings a wealth of experience in different fields. Crystal, you have the floor.
Thank you very much, Rose, and thank you so much for having me. I sometimes talk a little bit fast, and especially because it's evening time in Nairobi where I am. If I do, just flag me and I'll slow down. As Rosa said, my name is Crystal. I am the director of a very new initiative called NAWI, the AfriFem Macroeconomics Collective. And what we're doing is working on a macroeconomic issues and policy and advocacy from a Pan-African feminist perspective. And so, as you can imagine, those are two very different fights, but one that intersects very seamlessly. And so it's one against a neoliberal, neo-colonial agenda, but also one against patriarchy from a feminist perspective. And so it's an intersection of both a Pan-African as well as a feminist narrative working on macro. The reason we work on macro is there's a lot of work that's been done on the micro economic issues, microfinance, financial inclusion. It's still not enough. But there's definitely a huge gap in the work that needs to be done at macro to address more systemic issues, more underlying issues that have such a huge impact on the quality of lives of African women and girls. It makes a difference between what sort of schools my children can go to, what sort of hospital I can have a child in, and who's financing it, how quality of an experience I will have, and the quality of what that means. And so, like everyone has said, we're living in unprecedented times, COVID as a pandemic, but at the same time, the rise of the Black Lives Matter movement and the push against a global imperialism, against this very skewed and very unequal economic landscape. And both issues coming up at the same time really puts to the fore how all oppression is linked. It's an oppression of race, it's an oppression of economic divide, it's an oppression of the digital divide, it's an oppression of health equality. There's so many things that are intersecting at the same time, and 2020 seems to be the year where they're all coming to the fore and really showing the very soft underbelly of the system that we've been living in this false consciousness of, where so many of us have been. Am I still on?
Yes, you are. I think
Okay.
there was an unmuted person, but please
Okay.
go on. Sorry
Okay.
about that.
No problem. And so one of the really big things from a feminist point of view that this period and these crises bring up is exactly who is holding our economies up. and who these essential workers are, and the surprise that jobs like hedge fund managers and multinational tax consultants are nowhere appearing on those lists. And who's appearing is really becoming crystal clear around who is holding the economy up. It is nurses, it is doctors, it is people who work in supermarkets, it's mothers, it's caregivers, it's the people who have been for so many years not seen, not recognized, definitely not paid, and when they are really paid an unfair wage. And so it also pushes this narrative that we must see public services as an investment rather than a liability. And whose responsibility is that? And how can we push this narrative? We're at a point in a juncture in time where we can go one of two ways. We can choose to completely create a new normal about the way we do things and really move away from this very neoliberal, very unjust way and system that is globally run in this current, what has been up to this point, a current multilateral landscape. And we can move it towards a way that we are more equitable with our distribution and redistribution of wealth and resources and access to opportunities. And both COVID and BLM bring that to our fore. Very linked to that is tax justice and illicit financial flows movement that has been doing so much work. And it's really coming to the fore. I think the first speaker spoke about how we must have governments investing in some of these public services and goods. They cannot be a liability anymore. And so this pushes us to reimagine the role of the state. And from where I come from, reimagine the role of the African state. For so many years, from the structural adjustment programs, the role of the state has really been watered down. We've been told not to invest in public services and goods, that the market will take over. And this new wave of financialization with the IFIs, like the World Bank and the IMF, who are pushing us into more of a private finance model to our development. There'll be a PPP for our healthcare, there'll be a public-private partnership for our education. And the COVID crisis has really shown that this is not a strategy that works. We've got countries like Spain, countries like Ireland that are actually renationalizing hospitals and putting them under the public framework, because it's very evident that with the silos of privatization, we are not able to provide quality healthcare in a responsive way to our citizens. And so it brings to the fore again this conversation around reimagining the social contract between state and citizen. And I've said this repeatedly, and I'll say it again. What has been happening is that there's been a shift away from a social contract between state and citizen to one between state and private finance. And private finance is who decides what funding goes where, who gets what. I think there's a statistic that I heard today, 83 on the African continent per capita on health, $83 goes to every citizen. That is 2% of what the Western world spends on their citizens. And so we have to begin to think about what global health inequalities look like, linked with global health financing, and how equitable or not it is, and what the role of multilateralism is, especially in a space where countries are now very much looking inward, and we're having to look at local solutions for local problems, where we do know that there are very global solutions to very, very local problems with the international financial landscape and an economic landscape of that sort. The country I live in, Kenya, is now being able to do things that we were told we could never, ever do. We're producing masks locally, we're producing PPEs locally, we're not importing them anymore. And this manufacturing is something that we've never imagined that we could do by ourselves, but suddenly we're doing by ourselves. We question where the role of women in that value chain comes and who is the beneficial owners of capital and of wealth in those value chains as we go local. But then also, what does that mean when we're looking at multilateralism and solidarity across borders, across continents, across regions? What does it mean for vaccines that are coming through? And we have very painful lessons from the HIV a pandemic a number of years ago, and with our lack of access to equitably and properly priced drugs. And we wonder if we're going to repeat the same things, and where the role of multilateralism and progressive multilateralism lies. It's also a point for us to begin to look at our obsession with GDP and growth, which has been rising, and which has been also rising in tandem, which inequality has also been rising in tandem with GDP growth. there's 1%ers, and a lot of us are living, everybody else is living below a poverty line. And what is it saying about this very unsustainable way that the world is operating? And maybe it's time to look at degrowing. And now do we really need all this growth that we're going through? And how detrimental is it to both people and planet? And I think the crisis and Black Lives Matter shows that it's not. And so, again, with the tax justice movement, against a backdrop of Africa losing $100 billion through illicit financial flows, that that investment, that resource could go a long way in providing healthcare in crises such as these. At the same time, my continent is under such extreme debt, and so there's a push for debt moratoriums. But that's not enough. We need to talk about the structures that underlie the debt that we're taking and the decisions of this debt. 2 years ago, I was in Mozambique, and they had just opened a PPP bridge. And I was in a little tuk-tuk driving around seeing the city, and the driver says, well, this is the only time I'll be able to use this bridge. And I asked him why, and he said, today it's free, but from tomorrow they're going to be charging about $2.50, and I can't afford it. So we really have to be questioning who this development is for if it's not for our people, and where should we be putting the money. Debt is not a bad thing, but the questioning around, are we centering citizens and their needs? And there's a conversation about data from the speaker from UNFPA, and that's a very, very important point. Data can't just be gender disaggregated. It has to tell a gendered story. It has to tell a very intersectional story. It has to overlay issues of income inequality, income generation, geographies, religion, ability or disability, sexual status. Well, all those things need to come into play so we're able to make very targeted and very evidence-informed decisions to our own development. I will stop there, and we'll open for questions if I have any.
Great. Thank you, Crystal. That was such a brilliant presentation to connect a lot of the dots, a lot of the funding, finance aspects that the previous speakers had mentioned. And let me just ask, I'm just looking to see if there were any questions. Just a quick question about connecting the dots back to the multilateralism crisis that many talk about at the UN. And what are your recommendations in terms of supporting that, not only as global citizens, but also within the UN agencies that are also dependent on certain funding that may or may not come through at the UN?
Yeah, so from where I sit, it's sort of it's a crisis in many ways. So I have both the African Union to think about and the United Nations at the same time. And then I have UN Women to think about, and the Gender Directorate at the African Union to think about. And anything that has to do with gender is always underfunded. The US and their cutting their relationship with the WHO is a very clear sign of how we cannot be doing things going forward. The more this crisis evolves, the more it's telling us that solidarity is needed, that community is needed, and a global community is needed to be able to work together to fight this this pandemic and everything else that will come from it as well going forward in this new normal that we have to really focus on recreating in a progressive way, because it could just go the other way. And so there's a lot of pressure that's needed to make sure that financing is available from all our parties, that financing is available towards the departments, the units, spaces that is needed. And so UN Women for so many years has been so grossly underfunded. And what does that mean for the gender movement, for the women's rights movement, for the feminist movement? What does it mean when the world is saying we don't want to put money into a cause that's fighting for this cause? I think that says a lot about our global solidarity. It says a lot when the US is pulling out of the WHO. It says a lot when in my region in East Africa we're so inward facing. Tanzania is going through all sorts of things, and we've just sort of closed our borders and, you know, having to focus on ourselves. And at the same time, like I said, this crisis is really pushing us to work together, and it's relentless in that lesson. And I think unless we listen, we will not be going any further. Even with the World Bank and the IMF, there's questions around what sort of financing they're dangling for countries, and what debt conditionalities are being put on us, and what sort of global solidarity does that mean if we're using the same old strategies to solve problems that these strategies created in the first place. I think that's something that we need to question. We need to provide space for voice. We need to provide space for voice of citizenry to be able to influence these multilateral decisions and strategies. And I think it's a time where it's so easy to slip back into a very regressive type of regime, both in terms of the financial architecture, the multilateral space. And it's, you know, we really need to make sure we're fighting hard enough in our advocacy in our different spaces to make sure that we're recreating and reimagining a future that is completely different from where we came from.
Thank you so much. Certainly you're fighting at all hours, late into the night where you are. Thank you so much. We're going to turn to our last speaker, and certainly talking about bringing it local, New York, the US, but New York also is really where a lot of the focus of the initial COVID outbreak happened, the epicenter in the US and really in the world, when the numbers were so high, higher than any other country. And also where we saw a very large percentage of people of color really devastated by this disease. And so we have next Crystal Rogers. Crystal, if you can, there you are, I see you. Hi, Crystal, welcome. So Crystal Rogers works full-time fighting for healthcare justice with the New York Nurses Association, where she is a community organizer. Prior to this position, Crystal began her career in advocacy at a local union in Newark, New Jersey, where she realized the power of unity and began participating, in labor rallies and community organizing. Crystal moved through the ranks and became an education advocate, noting that parents were a missing link in early education. In 2016, she founded Standard Advocacy, a boutique consulting agency for child advocacy and for all disability support services. Most recently, Crystal wrote the book, My Superpower is Autism, that celebrates autism as a superpower based on real life experiences in her family. Crystal sits on the steering committee of the New York for CEDAW and to pass the East Orange CEDAW resolutions. So we welcome Crystal. Thank you very much. You have the floor.
Thank you. Thank you so much for having me. And thank you, Yvonne O'Neill, for inviting me and for being such a great mentor. I'm so excited to be with you all today. I'm a political and community organizer with New York State Nurses Association. You know, that's what I do full time. But a lot of times when I come into a room, I let folks know that I'm a parent because I'm an activist, and my passion is that there'll be quality of life for my children, you know, and in the future. And so what I love about CEDAW, the Convention on Indiscrimination Against Women and Girls, is it touches on all my activism. You know, I'm a disability activist, I'm an education activist, I'm a labor activist, I'm a healthcare activist. But in all these roles, I'm a woman first. You know, I'm a woman crying out, trying to amplify issues. And so it's been such a pleasure and joy to be a part of New York City for CEDAW. I want to also shout out Sheila Katzman, the chair, and everyone from New York City for CEDAW that's on the call. I'm just going to kind of walk through a presentation of what's been going on here in New York City. I talk a lot, so there's not a lot on the screen, but the title, The Multicultural Approach to Gender Impacts of COVID-19, I think New York City probably represents every country, every language in the world. It's an awesome place to work. And so I think whenever we're talking about multicultural, you know, New York City is it. And I was so happy to hear from the other panelists to really hear what's going on in different parts of the world and what the similarities are here in the United States, here in New York City. So I'm a slide ahead. And in New York City, we went into crisis mode. And so the CDC relaxed important guidelines. Before COVID, a nurse would have come out of a room with a patient that has a contagious disease and discarded all of her PPE equipment. And so, you know, the first rule of extending the equipment and for nurses to utilize their equipment up to 5 days was actually used against the workforce. And so even facilities where they had PPE equipment available, they were not giving nurses new N95 masks, you know, any sooner than the 5 days. And it was a struggle to get access to PPE equipment to the level where New York State Nurses Association intervened and delivered a lot of masks to our members on the ground at the hospital. And so that was one issue. Another issue was New York City hospitals actually doubled their ICU capacity within weeks. And so with the relaxed guidelines, hospitals were basically able to throw up units, make units, switch units, move patients. And in H&H, our public hospital system, they almost tripled the ICU beds. And so it wasn't just increasing beds and a physical thing, but also nurses now had to become ICU nurses. And so you may be an outpatient pediatric nurse. When patients come in to see their pediatrician, you work with the doctor to make sure that, you know, the patient is prepared and the patient is treated and has everything they need. Now you're an ICU nurse. And that happened within hours. And so the training was on the ground. It was very difficult and it was very traumatic for the nurses. Thank God they have a strong union that has a training department, and our training department really hit the ground running and providing training to our members. And so although management claimed that they were providing training, we found it to be inadequate. And so the union stepped in and provided a lot of training and had a lot of resources available to our members. The next slide is just the numbers, and I just thought this was cute. These graphs actually don't represent the numbers. And you can move on to key factors in mortality. And so what actually impacted the numbers was age. Black, Latino was twice the rate of white mortality rate. Low income workers added to the mortality rate. And so what we saw with age, patients of a certain age didn't have access to healthcare. And so what we heard in the long-term care facilities was that people were not even being taken to the hospital. Some patients just were not given the chance based on their age and pre-existing conditions. And so that's kind of difficult to swallow in healthcare, and to say a certain demographic doesn't deserve a chance to fight for their life. You know, and that's just kind of what happened. And even now today, I think we are still seeing that happen, where in long-term care facilities, people are not being moved to the hospital. You know, my personal experience, I have a loved one in a facility and patients are moved to a unit, then they're told they're well enough to return, and then they're back to the COVID unit again. And so we're still not in the clear here. This is still an issue, especially in long-term care facilities. Also, with long-term care, I think that they were almost neglected in the PPE distribution. And so our long-term care facilities, we almost had to cry out and beg and reach out to elected officials in order for them to get the equipment that they needed and for them to get attention. And so what happened in long-term care facilities across the board was really a disaster. And, most of the folks in long-term care are our seniors. The Black Latino being twice the rate of white, I think that had a lot to do with where the COVID cases were. And we're gonna go into that in the next slide. And then low-income workers, and just thinking about who low-income workers are. Folks that just cannot afford to call out, folks that were told that they were essential, folks that were threatened to be fired if they called out during COVID. They all added to the mortality rate. And so folks really had to make a choice. Are you going to go to work and risk exposure, or are you going to lose your job? And so I wanted to talk a little bit about Queens, which was the epicenter of the epicenter, because Queens led the country in numbers for a while here in the United States. They're the largest borough in New York City. They have the second largest population. But I think what's important about the population is 47.5% of these folks in Queens are foreign born. And so it almost felt like the United States neglected them on purpose. That's how it felt. Not that that's what the case is, but for it to be almost half foreign born and for the numbers to be so high, I think it says a lot about our government and how we distribute services. There was already a shortage of hospital beds in Queens. We call Queens a healthcare desert. There was already a shortage in staffing. And so not that Queens was alone in staffing. New York City, has a staffing crisis, but it added to the mortality rate. And we're gonna go a little bit more into that in the next slide. And then I added the shortage in housing because there's really a housing crisis in Queens. And when you think about a housing crisis, you have to think about the homeless population. You have to think about the number of people that were in the subway. You have to think about the number of people that had to go to a homeless shelter once they were forced out of the subway, and the close capacity these folks had to survive in. And so that's all in Queens, and not that Queens is the only borough or the only place like that, but I think that, they became the epicenter of the epicenter because of the disparities that already existed there. So gender and COVID, when we think about essential workers, for us at New York State Nurses Association, we represent nurses. The majority of our workers are women. And if you think about women, we're mothers, we're caregivers. These mothers took the subway to care for patients in relaxed safety conditions and had to return home to care for families. And so nurses were not alone in that. In thinking about essential workers, there were a lot of mothers forced onto the subway in New York City during COVID to work in relaxed safety conditions. Our nurses actually work in a hospital where the CDC, enforces regulations. That was not the case in most workplaces. And so folks were really exposed going to work, really exposed riding the subway. I want to say the MTA lost more workers than any other industry during COVID. And so, I think that's where gender really plays a huge role.
Crystal, can you say what the MTA is for our
I'm sorry. So the
audience?
MTA is our transit system. I'm sorry for folks. I know this is an international call. The MTA is the transit system in New York City. Most folks take the subway. It's the easy, quick way to get around. And it took them, I want to say, months to begin to manage the subway and say, we want to disinfect the subway to make sure that it's safe. And honestly, prior to COVID, I don't think that that was even a conversation in New York City, disinfecting and cleaning the subway. You know, on a typical day, it's shockingly disgusting. And during COVID, I think that, you know, it just helped to spread the disease, honestly, you know. And so eventually, at some point, they decided we're going to shut down the subway in the middle of the night to disinfect the subway. But by that time, there were so many subway workers that had passed from COVID, it was unbelievable. And so they almost had to address it based on the number of deaths in that industry. And so I want
about 1 minute.
I'm sorry?
You have about 1 minute left.
Okay, and I'm finishing up. And I want to talk a little bit about the disparities, you know, and when we talk about women, when we talk about pay, nurses were brought out of state. They were paid a tremendous bonus for working in New York City during COVID, and it made it very competitive. And so in Queens, where we had high numbers, these nurses were less likely to sign up and take assignments in Queens. And so they're getting paid large bonuses, and then they get a choice of where they actually wanted to work in New York City, where our nurses had to fight tooth and nail, negotiate with management to receive a bonus during this time. And some members walked away with a $250 bonus, period. Some walked away with none. But it was a labor management fight, and it wasn't just given. And when we talk about finances, I want to point out that the CARES Act funding in the United States gave $50 billion the first round, $12 billion to high impact hospitals, and $1.5 billion of that New York received. And so, you know, the larger hospital systems that don't care for poor patients received an abundance of this money. And not that our public hospital didn't receive any money, but, you know, they definitely got the short end of the stick, and they had to wait for the 12 billion high impact money to really receive anything of significance. And so what we learned in COVID was mental health matters. We spent a lot of time amplifying the need for mental health. And at the same time, our government is defunding mental health beds. They're closing mental health beds in our hospital systems. There are less mental health services available during this time. And so that's something that we really want to amplify in New York City. We have all this money being funneled in, but we're closing mental health beds whenever the need is greater than ever after COVID. We saw that for patients, for our community, and for our nurses as well. It was very difficult to watch our patients and loved ones die without a physical touch from another person. Labor management partnerships, really, I thought the public hospital system did a great job in informing our nurse leaders of what was happening, what the case numbers looked like, where the PPE was, and how people could get access. And I think if our public hospital system can do that with little money, these private hospitals definitely should follow suit. We want to prepare for another surge, which we believe is coming in September. And so we don't feel that we are anywhere ready as far as equipment and preparation. We want to fight for protective policies. We believe that if workers are protected when they go to work, then it's easier to protect the public. And community collaborations. For us in the current climate, I think that all the racial justice activism that is happening right now has come from COVID, and just the communities that were impacted and dying from COVID are the same communities that face police violence, are the same communities that don't have access to education, the same communities that don't have access to comprehensive health care. And so, you know, for us, we want our nurses to have one conversation with the community about disparities and how it impacts them inside and outside the hospital. And my contact information, folks are welcome to reach out.
Thank you, Crystal.
Oh, so This is a
Thank you.
political question. Someone's asking, how do I think Cuomo handled the COVID crisis in New York and Mayor de Blasio in New York City?
Well, we have just
Okay.
1 minute or so if you can answer that. If not, we
Yeah,
can bring it back
and I will
around.
quickly. I think for me, it comes down to they cut Medicaid during COVID, and that says it all for me. They cut Medicaid is, you know, public dollars for healthcare, people that can't afford healthcare, and they cut funding to Medicaid during COVID while people were dying, people of color that don't have access to healthcare, immigrants that don't have access to healthcare. You know, they cut the funding to help those people.
Thank you. This really is a convergence of a lot of these issues about public-private partnerships that Crystal mentioned, about the lack of care for poor populations that Dr. Manab mentioned, and also issues related to gender and gender inequalities and discrimination that Madam Diop mentioned. So this, what you presented, has been a very real life information, a convergence of these issues. So thank you very much, because this is I'm sure information, and what you've been dealing with is on a very real basis, and very difficult also, having to deal with all this and live it. So thank you very much appreciated. What we're going to do is, I want to bring it back to some of our first speakers, so that we can have, we have about, let's say 20 minutes, 25. I know that Huri wants to come back at the very end for questions. And I want to bring back Dr. Minadme and ask, I think there was a previous question about a universal health coverage for developing countries. And this is on the back of what Crystal Rogers just said, what Crystal Simeone has said, and it's kind of ironic we have these two crystals who are very much crystallizing this information. So Dr. Renagbe, I want to bring you back while people gather some questions. We're going to have a few questions that people can ask live through video. But I wondered if you can comment on this question that surged while you were speaking about universal health coverage in developing countries, excuse me, and that being very expensive, and what the strategy is for this initiative. If you can turn on your video, Dr. Perhaps she's not hearing. Okay, can we bring on Madame Diop from UNFPA? Can you provide some information about this question of universal health coverage for developing countries, and what the strategy?
I won't be in a comfortable position to say that, even if we work very hard to integrate sexual and reproductive health into the universal health coverage. But I think that is WHO led, initiative, so they're in a better position to answer.
Okay. Well, I think there might have been, she might have been called for something else, but we'll await her. So let me open the floor for any questions that people may have. If you want to turn on your video, and I believe that Devin will be able to unmute you if you're unable. So we open the floor for any questions. Also, if you can just raise your hand in the chat or put a little asterisk if you have any questions for our presenters. Aside from very many applause on the chat, we've been trying to gather some of the questions. So yes, anyone, just you can raise your hand, and if we see you.
Rosa, I see two hands, actually three right now, Esther, Shanti, and Suzanne. I don't know if you can access that on your computer.
Okay, so let me see. I see Shanti Baker.
Yeah.
Yes, thank you. I'm out in California. I'm an educator. I wonder about health and finance, because so much has to do with educating the young and educating people about how to use preventative health measures, how to have financial literacy, and even with gender-based violence, how to teach boys and girls how to be respectful of each other, how to teach people about the danger of female genital mutilation. How do we make a global thrust for education that's going to help all these intersectionalities?
Is there anyone in particular you want that question addressed to?
Whoever feels comfortable. Crystal, since she lives in the US and I'm a US based person, and you have an international community over there. Or, I'm sorry, Crystal.
Thank you. Yes, thank you.
So for me, I do a lot of mentoring, and I kind of visited this conversation and my frustration with advocacy a few months ago, and someone asked me, well, you know, focus on a thing you can do to make a difference. And so, you know, I said I'm going to focus on the youth, and I planned a youth leadership camp, a 1-week camp in my community, which actually we're not able to accomplish because of COVID. But the book that I wrote with my kids, I plan on using it as a tool. And it started out as a diary entry that I read out loud to my kids, and I saw the empowerment happen in front of my eyes, if that makes sense. And so they helped me put the book together, and I plan on using it as a tool to read a story and have a discussion. And so in the book, you can see, you know, my kids talking about autism and how great it is. And it gives us an opportunity to talk about our differences, whether they're gender differences or ability differences. There's mention of my daughter who's not special needs, but how she still is super and she has to advocate. There's a picture of my kids with the city council when we passed the resolution, and it gives us an opportunity to talk to children about civic engagement and what they can do. There are children highlighted in the book that actually advocated for East Orange for CEDAW in their classroom, recruited teachers, their councilmen. And so it gives us the opportunity to talk about what they can do where they are. And so for me, it's kind of like giving myself and my time to the young people in my community. And I never dreamed that I would be an author. I really just thank God that, you know, he used me to be able to amplify a message. And so, you know, I'll humbly now take that and share it as a tool, a training tool, not just for disability, but for civic engagement for young people. I think it's very important. And one of the things that we wanted to touch on in the camp is financial literacy. And now that we're unable to do it in that forum, I'm thinking about, is there a place in our churches, in our community organizations, where we can set up workshops for our young people?
Thank you, Crystal. That book is My Superpower is Autism. And thank you really for sharing about your personal life. You can read more about her bio in the newsletter on this event that the NGO CSW has sent. So we have another question from Esther Udehi. If you can unmute and if you want to put your camera on.
Yes, thank you.
Esther. Go
Well,
ahead.
thank you very much. My question really is to Crystal, Simone, or in fact to any of them. I was wondering, in all these loans and grants of funds, especially to the African countries at this time of the pandemic, is it possible that there will be some conditionalities where they will say that these are being given on the condition that there's a percentage of women amongst the management of these funds? Because obviously when the women are involved in managing the funds, it's better and you can erase corruption to a large extent. But some of these monies are being given out and there are no women among the committees that are managing these funds. And so you don't.
Esther, where are you calling from? Where are you tuning in from?
I'm calling from Nigeria.
Okay.
Are you hearing me?
Well, it was in and out, but Crystal, do you get the gist of her question?
Yes.
Okay,
Yes, I
thank
do.
you. Thank you very
I
much.
did. And so I think the first point is there's already a transparency problem with the resources that we're getting, whether in loans or grants, and it's very, very unclear how this money is being spent and where it's being spent. So that's the first. I've been doing a bit of work with a few women's rights groups working with budgets and influencing the COVID response in Kenya. And what's come out very stark is that the gender directorate is so underfunded that there just aren't enough staff, enough women power. Instead of manpower, there's not enough women power to influence or advise and play advisory roles in committees and policy making, groups that are very quickly rapid response are in this rapid response zone. And so issues around women's rights, issues around, what do we do with GBV? Just this week, there's been an announcement of one of Kenya's 46 counties having 4,000 teen pregnancies from March to June, and that's an incredibly high number. But if we don't have resourcing to go to women's rights organizations, but also the gender departments within government, then it's very hard to make sure that the right decisions are being made. So definitely not, we're not having any money earmarked towards, women leading. But also, just to say that I am very strongly of the opinion that, corruption is not linked to sex or gender. It's a framing. It doesn't have any. It's not influenced by what gender it is. It's a school of thought. It's a vicious thing that happens. So even just in Kenya, one of our women governors, one of only 4 in the country, has been in quite a bit of trouble due to corruption issues, and it's sort of hard to support her simply because she's a woman. And so I think we also need to divorce the two and de-link that. Yeah, but definitely I agree there needs to be earmarking for gender response in the corona crisis, but even going forward, there needs to be an allocation specifically to gender departments in government. Otherwise, it's all talk, and you can talk about, gender disaggregated data or making gendered impactful policies and strategies, but if you don't put the money where it needs to be, then it's nothing. Rose, I think you're muted.
Apologies. Yes. I just wanted to ask Madam Diop if you wanted to add to that. I see your microphone is unmuted. If not, we'll move on to some of the other questions.
No, not specifically on that one, but I was going through the chat and to see a little bit
if
what was the
maybe
question.
Lower your volume on your computer. There's a little bit of an echo.
Echo, yeah.
Excuse me. Yeah, please start again.
Yeah, so I was just going through the chat and see what kind of question were there, and if I can pick a few of them. I think that my colleague, actually Meltem, who is connected, already sent the link, because I think that a lot of people requested the data that I was announcing. So just to let them know that in the chat you have the link, which is there, and where you will be able to see some of this data. And the publications and all. So the second thing is I think some people were requesting additional information on child marriage. And so beyond the projection that have been made, what we just know is that the reporting of in a lot of countries of increasing on child marriage due to actually all the incertitude. And we all know that girls are in a lot of places seen as commodities. And so they are actually the first one to pay the price for the family survivor and the brides, etc. So it's there is a revenue that families can get out of trading their girls, earlier. So that is being reported a lot here and there. The statistics are not clear yet, because we're trying to collect as much real-time data as possible, but you can see the difficulty, and even people, highlight the fact that even here in the US, sometimes the data are not disaggregating only per sex, and we are not even talking about other like disabilities and other. So we were trying, and probably will take us a few months to be able, as a UN system, to provide more solid data on what is happening in and the impact on the issue like teenage pregnancy, like child marriage, like female genital mutilation. But what we know is that already the activists through media and social media are reporting, increasing cases. The other thing that I wanted to say is that in terms of older women, and I saw a comment about it, and this is true, that the focus has not been made sufficiently on older women. And I just want to again invite you to look at a piece that has been produced by UNFPA on aging within the COVID crisis. There is a brief and a guidance note that has been produced. So you can also look at that, and I will try to pass the link in the chat box. But any unfpa.org, you go there, you will find a lot of things on the COVID-19, a lot of documentation has been there. And then I think that I just want to raise my voice also to one of the requests from a French speaker, and because I'm French speaker myself, and I'm trying really to do my best to publish all the documentation that we have in French and English and Arabic, at least those three languages, as much as possible. So I think that she's feeling that she's a little bit left aside, and would appreciate to have a translation. Donc, pour ma sœur francophone, qui a l'air d'être africaine d'ailleurs et peut-être de mon pays, je voudrais juste dire que vous avez raison. Il faut continuer à vous battre pour avoir plus de documentation en français. Merci. Thank you.
Merci beaucoup, Madame Diop. Thank you so much for that. We're going to try to squeeze in these questions. Why don't we have two at a time? I'm going to ask, it's Suzanne, the name is just identified as Suzanne, and Chanel Brown, as I see them, and then we'll try to move on to Celine and Nerea. Suzanne, can you unmute?
Yes, okay. I think I did that.
Please lower your volume on your computer. Yeah, thank you.
Just bear with me. I'm just learning my way. Is that better?
Yes, much better. Thank you.
Okay. So my question is for Ms. Crystal Rogers, and the issue in Queens, and I'm from New York. And I want to know who she holds responsible for the delay. And really, I believe there's going to be a second wave, or there could be a second wave. What can we learn from the first experience so that we don't repeat the errors the second time?
Thank you, Suzanne. So let me ask Chanel Brown, or if there's a follow-up question to that related to Crystal, from those who have raised their hands. And I see Chanel Brown, Celine St. Clair, and Nerea Amondi Okech.
Hello, this is Chanel. So I'm able to, my question is not related, so I'm able to ask that.
Yes, why don't you say it, and then we'll make sure we can get it in, because I saw your hand went up earlier. Yes.
Yep. Thank you again. I'm representing the International Black Women's Public Policy Institute, and we're headquartered in Atlanta, but we service the globe. And my question is around female leadership, because earlier in the presentation, I heard that there's a dearth of female leadership. And I'm seeing some countries that are headed by female presidents are doing much better in their COVID-19 response. So my question is open to the whole panel, how can we start to assert female leaders on the grassroots level, whether it's female empowerment groups and villages? Are there opportunities to make sure that their voices are heard in the COVID-19 global response?
Thank you, Chanel. So Crystal Rogers, why don't you take that first question? And then the second question, I think, Madam Diop, you had mentioned the issue of female leadership, and I'm sure Crystal Simeone, you can come in on that as well.
So how to prepare better? I think that a lot of regulations came from the top down, and it was a struggle to amplify the voice of the nurses. And so the CDC relaxed the regulations, the facilities put policies in place, and as a result of what happened next, our nurses had to then begin to advocate through their elected officials. And then their elected officials began to have policy conversations. And so I think the next time around, we need to think about what we learned from the ground, the essential workers on the front line, and actually accommodate the front line, opposed to all the regulations and policies coming from the top and being based on money. Because some of these facilities didn't have to be giving out one N95 per week. They had a supply of N95, and just because the rules were relaxed, they did what they could do to save $1 at the detriment of human life. And I do also just want to touch base on the other question. We have a nurse that's also at the New York State Assembly, and we worked very hard to get her there. She took off her suit and put on her scrubs, and she was able to say, this is what's happening on the front line. And I think many times our elected officials are career politicians and not real people that have real jobs to come back to. And I think we need to do more of that, pushing our community activists, our union activists, our people that are used to advocating into elected positions.
Thank you so much. Madam Diop or Crystal, on this question of women's leadership.
Yes, thank you so much. I think it is also, we need to recognize that it is a program, a process. And, I think that all the UN agencies are really trying to support, women leadership, and particularly UN women and leadership in the political sphere. So it's one of our, big priority agenda. But as you know, it's a process. And while we have gained a lot in several countries where we have almost parity now, in 50%, in the parliament and in government and all, there is a lot of other place where it is more and more difficult, to really reach that level. And in some cases, we have even lost, some of the gains. So I think that it's a fight, and we need to continue to as civil society organization for you, to really raise our voices and to support as much as possible through capacity development, through leadership sessions, and all, to make sure that we not only leadership with management and economic leadership, to make sure that we are going to see over the years that's a growing number of women. We currently have an initiative with Columbia University and with Professor Terry, my group, and on actually under the COVID response, to really address this women leadership, because it was so I mean, scary to see that we didn't have that women leadership in the COVID responses in most of the countries. And so this is a new initiative funded by Columbia University and UNFPA to take some specific countries and see what we can do, in a very short and very rapid time, because COVID is here, will stay for years and decades, we don't probably, and then we know that other crises will hit and other virus will come. I mean, we have disturbed so much, everything in the nature, that this is coming, and so we have to live with that. So we really want to learn, how to do that better, and at least next year to be more prepared and to see maybe a growing number. So we are testing some strategy with Columbia University now. Thank you.
Thank you very much. Now I want to see if these last two, Hori, do we have time for these last two questions?
Absolutely. Let's give them a chance, and if they can keep it short, that would be fantastic.
Okay, so Chanel Brown, and then following Nerea Amondi Okech.
I think I'm good. I just asked my question. So
oh, yes, you did. Thank you so much. It was the leadership one. Thank you so much for joining, and apologies on that. Nerea, I see you at the bottom of my screen. If you can unmute and ask your question. Nerea? Unmute, we can't hear you. Unmute and ask your question. Okay,
or perhaps type your question.
Or type your question in the chat. Okay, so those are the only questions or hands that I see while Nerea is typing that, and maybe we will need to follow up and provide information on her question. Can I?
Sorry, yes, I'm with you. And so I run an organization in a rural county called Now Foundation. So I touch on the lives of women and girls, particularly issues of welfare and social protection. In addition to that, I was also in Kenya.
Okay.
Yes, in addition to that, I was also last year elected as the quote unquote female president from a national program competition on women in leadership. And I want to say something about access to resources for women leaders, especially at grassroots level. For the last 3 months since COVID, I have been actively seeking out partners to ensure that I address issues of teen pregnancy, defilement of girls, especially in the rural counties in Kenya. It has been a challenge, and in terms of leadership, the women in rural counties have not been able to really be felt. And when we say COVID-19 is an opportunity for the world to see what women leaders can do in terms of managing crises, we have seen that in New Zealand, we have seen that in Taiwan, but I will take offense a lot of times with donor partners that bring resources. A good example is EU brought a lot of resources into Kenya, but tapping into these resources to ensure that we really get onto the ground and deliver the work has been a problem. I will give you a case in point. I had a rape case of a 23-year-old woman, and I reached out to the National Human Rights Commission, which received over about $50 million to support GBV in times of crisis. I could not even get resources. All they did was to call me and ask me for the data and information about the case so that they could file it and report it at national level. And I still have to handle the case in the rural county. Just yesterday, 20 rural counties in Kenya have witnessed a surge in teen pregnancy. So girls are not going back to school. So please, kindly, UN Women, when looking for organizations to work with, we are women leaders who are trained, who are developed, we are grants managers, but we are sad because the organizations that keep getting resources are the big organizations. Money is not reaching us. We cannot make the difference in the lives of women, but we are with these women where it matters the most. So it's very frustrating for us. We need help.
Well said. Thank you. Thank you very much, Nerea. Can I ask if there's, from the speakers, any last remarks and to speak to this issue of women's leadership? Okay. I don't see anyone unmuting, and I think that so much has been said. We appreciate your comments and your questions. At this point, I'm looking at the time, and I just really want to thank all of our speakers, Dr. Nata Minadbe, who I'm sure in her position has been called to do some other important charge. Also, Madam Nafissatou Diop, Crystal Simeone, thank you so much for sharing all your wisdom, and Crystal Rogers as well for sharing your life experiences and information. And again, I want to thank my co-organizer, Yvonne O'Neill, and our support, Devin Ziegler and Huri. So thank you all, and I'm going to turn it back to Huri, who's going to close the session.
Well, I think we need to thank you, Rosa. You are so awesome. You're an amazing moderator. I thank you so much for stepping up. And I want to thank Yvonne as well and all the speakers. And I want to specifically point out Nerea. I don't know if Nerea, if you're seeing the chat, it was so good to have you speak up at that last minute and give us that, you know, that extra energy to just keep fighting for everything that we're doing. This is traditional, and especially since it is our last meeting until September, I want everybody to unmute themselves, to put themselves on camera. I want to feel the energy globally of these amazing activists who give so much. And thank you all for joining. It's so good to see so many familiar faces. I want you all to really pay attention to self-care. I'm saying that to myself as well. Take good care of yourselves. Keep in touch with us. And yes, just like you say hi, goodbye.
Bye.
You all.
Thank you.
Bye.
Stay healthy. Stay healthy.
Executive committee and all NGO CSW members.
Thank you.
Great job.
We will share this chat. We will share the recording.
Yeah, thank you.